Jonelle, would you like to make a statement and let the staffers know your availability as a chronic pain patient?
Sure. My name is Jonelle Elgaway. I am 40 years old, and I've dealt with rare and painful diseases for the last 24 years. I've always loved playing sports. I was a huge adrenaline junkie. I won a spot to try out for the Junior Olympics for field hockey. And a week before tryouts, everything was almost taken away. As I drove home from softball practice, I was rear-ended by a truck going 55 miles an hour. I was life-flighted to a hospital and found out I broke my C3, C4 vertebrae. With a lot of hard work and physical therapy, I would go on to recover, and I won a spot on the B squad in the 1996 Olympics. I also won an athletic scholarship to the Ohio State University. After college, I worked for a private law enforcement firm, and I owned a business flipping houses. And then in 2003, I was in another car accident. I was briefly paralyzed in my left arm and hand, and I needed emergency surgery in my neck. I would go on from then until now to have 5 total neck surgeries. I'm fused from my C3 to C7. I have 4 rods in my C6-7, and I had a laminectomy. Wow. I have degenerative disc disease, Raynaud's disease, PTSD, complex regional pain syndrome, fibromyalgia, and most recently, tachycardia. I cannot have children because of my disabilities. I'm a perfect example of someone that is overall healthy despite my neck issues and my diseases, and how the body reacts to someone with long-term out-of-control pain. 2 years ago, I was lowered off 2/3 of my pain medication. I was on these medications for 15 years. I started having blackouts, constant flare-ups, out-of-control pain, and then I started having tachycardia. I have an internet talk show also, and my health got so bad that I wasn't able to work anymore because my memory was terrible. I was bedridden. I had a heart monitor for 24 hours on, and while I was sleeping at 3 a.m., my heart rate went from 60 to 150. And I could have had a sudden heart attack or stroke. My primary care doctor and my cardiologist both said that I needed to find a way to get my pain under control, but they didn't want to do anything for it. My pain management doctor wanted to continue with the treatments and medications that were not working. And I consider myself extremely lucky because I was able to find a rare disease specialist, and he decided to put me back on my pain medication that I was previously on. Within 8 weeks, my tachycardia was almost non-existent. My blackouts rarely happen now. My memory is back. I can wake up and be productive again. My flare-ups are less often, and I'm able to keep my pain under control for the most part. I mean, it still happens, but you know. Again, I am one of the lucky ones, which is why I'm here to speak on behalf of the 26 million or so intractable pain patients. I'm here for the patients that have committed suicide. I'm here for the patients that have turned to street drugs and can possibly die because they don't know what's in these drugs. I'm here for the patients living in pure hell and agony because they have been tapered against their will or completely have taken off their medications, and now they're just miserable. These are the 3 options that the 26 million people have or are about to have if we don't get help. There are around 110 million chronic pain patients in the United States, and examples of this is like somebody with arthritis or back pain. There are 26 million of us intractable pain patients, like myself, that deal with non-cancerous painful diseases or health issues where shots, therapies, basically everything has been tried, and pain medication is a must that is able to break this, along with other treatments and medications, to have any hopes of quality of life. Did you know that today 5 to 6 million of these intractable pain patients have been completely taken off their medications or tapered due to the reductions because of the CDC guidelines? If you're concerned about overdoses and addiction, why focus on patients that have safely taken their medications for years? I've been on my medications now for 15 plus years. I am not going to overdose, and I'm not going to be an addict. There is less than 2% of addicts in the United States. This number has not changed in the last 60 years. That's under 2 million addicts within the US. Did you know that the CDC guidelines were created mainly by addiction specialists? There was not one doctor or specialist on that panel that treated or studied pain management or had dealt with rare diseases or health issues concerning pain. So listen up, policymakers. There is nothing we could do about the past, but we can work on the now. If you're concerned about overdoses and addiction, making the CDC guidelines into law, it will not work. Having the DEA raid doctors' offices and shutting them down and taking away their licenses does not work. Tapering patients off their meds and lowering them to the CDC guidelines of 90 MME, which is morphine milligram equivalent, does not work. Your current policies are creating more overdoses, your current policies are creating more street drug use, and your current policies are creating more deaths and suicides. Patients are not a one-size-fits-all. If you have a 300-pound pain and a 110-pound woman and place them both on the same MMEs, that just doesn't make sense. I have a few suggestions for solutions. Number one, lawmakers, do not create any new laws or policies with data used from the CDC. As Dr. Klein mentioned, we now know that the CDC data is flawed and manipulated. The CDC recently admitted this, that they inflated the overdose numbers, and the CDC should be held accountable, and Congress should hold a hearing so we can find out what happened and why these numbers occurred even. Number two, the CDC guidelines should be revoked and instead use the Federation of State Medical Board guidelines. That was written by doctors and medical boards specializing in pain management. Number three, doctors should be given reimbursements as a palliative care visit instead of an office visit. Many states now accept this, and doctors need to use the palliative care certificate and exemptions. This will allow doctors to prescribe pain medication over the CDC guidelines of 90 MME. Centers for Medicare and Medicaid, or the CMS, plan to use the CDC guidelines, which has no scientific studies supporting that the CDC's 90 MME or the CMS's 200 MME levels are dangerous and can cause overdose and addiction for intractable pain patients. The CDC proposed a scientifically unsupported threshold of opioid abuse risk at 90 MME. Again, there are no studies to support this. And in fact, the FDA scientists did a study finding out that there is no difference of pain between cancer and non-cancerous pain. Number four, we could fund programs to help build institutions like what the VA has, and institutions that are being set up all over the world right now to take care of patients properly through multidisciplinary programs. Let's be real about the limitations on alternative therapies. Hardly anyone provides them, insurance doesn't cover them. There are no treatment plans set up to help patients if taken off their pain medications. Because I know a lot of people often say, we'll do alternative things. They're out there, but our insurance doesn't cover them. And most of us that are on disability, we can't afford those. Number five, fund better education for physicians on long-term patient care concerning pain, rare diseases, and chronic issues. And number six, stop trade embargo in Mexico and China until they deal with their illegal trade of illicit manufactured fentanyl. Because that's what we have right now. This is not an opioid epidemic. It may have been back in 96, 97 or whatever, but now it is an illicit manufactured fentanyl issue. And that's poison, basically. Did you know that when chronic pain patients use their medications properly, addiction is almost non-existent? Again, intractable pain patients cannot be dealt with in a one-size-fits-all manner. We are not going to suddenly become addicts, and we're not going to overdose after years of safely being on our medications. We need to let the doctors treat and prescribe for their patients how they deem fit. No one is immune to becoming sick like this, and I wouldn't wish this on my worst enemy. This could be your daughter, your son, your grandkids. This could be you. Don't we all deserve the best quality of life and to have the opportunities to receive the best levels of health care? What is currently going on does not work. This is a simple problem with a simple solution. We need to allow patients to have access to the correct medications and treatments that they need to live. There is no playbook on how to deal with life when it's suddenly turned upside down and inside out. And we just want the opportunity to live and to be a productive citizen of the United States. And I'm just asking for your help. And on behalf of the 26 million people out there, to give us the opportunity to live and to have a